Hello guys, this is me Dr. Kashan Qasit. Today here we were discussing the ECG pattern. In previous lecture we have discussed the left ventricular wall hypertrophy, causes for the left ventricular wall hypertrophy, and some of the images or ECG patterns regarding this topic of left ventricular wall hypertrophy. Today we are going to discuss another topic, which is right ventricular wall hypertrophy. So basically we will cover in this topic number one, what is right ventricular wall hypertrophy. Then obviously we will be discussing some ECG patterns regarding this topic of right ventricular hypertrophy, and we will also discuss the causes for right ventricular wall hypertrophy, what are the different causes or reasons due to which right ventricular wall hypertrophy occurs. We will also discuss in the next part of the video about how to diagnose this right ventricular wall hypertrophy clinically, and which test is required to confirm the diagnosis for right ventricular wall hypertrophy. So let's begin with the basic definition of right ventricular hypertrophy. Right ventricular hypertrophy is defined as the thickening of the wall of the right ventricle of the heart. This condition occurs when the right ventricle has to work harder than the normal to pump the blood. This increased workload causes the muscle fiber in the right ventricle to enlarge. So this is how the right ventricular hypertrophy occurs, and there are the reasons for this right ventricular hypertrophy. The causes for the right ventricular hypertrophy involve chronic cor pulmonale, mitral stenosis with a pulmonary hypertension, which can be due to any cause. Whenever there is a pulmonary hypertension, there is a raised blood pressure in the arteries in the lungs, we call pulmonary arteries. So these arteries causes the resistance to the workload of the right ventricle. So this is how the right ventricular workload increases, and this leads to right ventricular hypertrophy. There are other conditions which are congenital, like teratology of Fallot, ASD, VSD, and tricuspid regurgitation. There is also condition of Eisenmenger syndrome, in which you will notice the right ventricular hypertrophy. Likewise, pulmonary stenosis also leads to right ventricular hypertrophy. So these were all the causes for right ventricular hypertrophy. So in order to diagnose right ventricular hypertrophy, you will also look at the clinical scenario. So clinically, in order to diagnose right ventricular hypertrophy, you have to look at the following points. Number one, while going for palpation of pericardium, number one point you will notice is left parasternal heave. Second thing you will notice is the epigastric pulsation. There will be the features of pulmonary hypertension, and the signs of pulmonary hypertension involves low volume pulse. There is a palpable P2, left parasternal heave. So these are all epigastric pulsations. So these are the signs or features of pulmonary hypertension. So these are all the points in order to diagnose clinically right ventricular hypertrophy. So in order to confirm the diagnosis of right ventricular hypertrophy, you will go definitely for the test, which is echocardiography. So 2D echocardiography is the investigation in order to confirm the right ventricular hypertrophy. Now coming towards the ECG criteria of right ventricular hypertrophy. The ECG criteria which is commonly used is number one, the tall R wave will be seen in the V1, which should be greater than 7 mm, means it is greater than 7 small scale boxes. Also there will be the deep S wave in the V5 or V6. There are other criteria which are like R to S ratio in the V1 is greater than 1, like R is greater than S in the V1, R in the V1 plus S in the V5 or V6 should be greater than 11 mm, means greater than 11 small scale boxes. There is other criteria like you will notice the S wave which is in the V1 should be less than 2 mm, and R in the V5 or V6 less than 5 mm. There is also a criteria like R in the EVR greater than 5 mm, S in the V6 greater than 7 mm. So all these are the criteria in order to diagnose the right ventricular hypertrophy on the basis of ECG. So there is also right axis deviation which is normally between 90 to 180 degree. So this is the also criteria for diagnosing right ventricular hypertrophy. So here is an ECG which is showing tall R in the V1. You will look at the ECG, you will see there is a tall R wave in the V1. So this is the criteria for diagnosing the right ventricular hypertrophy. So I am going to display some other ECGs which are showing the right ventricular hypertrophy, and these are also fulfilling the criteria of ECG criteria of right ventricular hypertrophy. So until now we have seen the right ventricular wall hypertrophy, causes for the right ventricular wall hypertrophy, clinically how will you diagnose the right ventricular hypertrophy. We have seen the ECG patterns also of the right ventricular hypertrophy. Now it is important to note that the ECG findings cannot definitely diagnose the right ventricular hypertrophy, as similar pattern can be seen in other conditions such as right bundle branch block, pulmonary embolism. Therefore, diagnosis typically requires clinical findings. Also, in order to diagnose, there are diagnostic tests like echocardiography. So this was all about the right ventricular wall hypertrophy. In the next video, we will be discussing the left and right both ventricular wall hypertrophy, and we will display some of the ECGs which are showing the right and left both ventricular wall hypertrophy. So this was all about today. Hope you like my video. Thank you very much for watching. I'll see you in my next video.